Resuming debate, Senator Dasko.
Thank you, Speaker. Senators, I rise today to speak to Bill C-4 at third reading. First, I want to thank our colleague, Senator Dean, for taking on the task of sponsoring this legislation. Colleagues, here we are again considering another piece of legislation, the seventh piece, according to Senator Harder, introduced to address the COVID-19 pandemic. I think back to the first pieces of legislation, which built on existing program structures, then the next pieces of legislation, which created new programs, new income supports for individuals and businesses, and then yet again to another round of legislation fixing the gaps and extending these new programs. And now another bill to fix, extend further, and create new support programs in an effort which will hopefully take us to the end of the pandemic. The legislation before us provides details of a support plan first announced by the government in August. The termination of the CERB on September the 26th would have left many Canadians without support, and this bill will fill the gap for many who would not otherwise be covered by employment insurance. Bill C-4 is an omnibus bill which implements a variety of benefits programs meant to carry Canadians through the foreseeable future of the pandemic. Included are the Canadian Recovery Benefit, which provides 26 weeks of support at $500 a week for those experiencing unemployment or underemployment, the Canada Recovery Sickness Benefit, which ensures all Canadians have access to sick leave, and the Canada Recovery Caregiving Benefit, amounting to $500 per household to support those caring for family members with COVID or children who cannot attend school or daycare due to the virus. In addition to benefits programs, the legislation includes amendments to the Canadian Labour Code that facilitate sick leave in the case that an individual or someone in their family contracts COVID-19. With the recent surge in COVID-19 cases and with the uneven economic recovery, it is inevitable that this legislation will not provide support for everyone in need, nor indeed for everyone affected by the pandemic. Still, it is very much needed and it is worthy of our support. The COVID-19 pandemic is a health crisis and an economic crisis. All Canadians have had their lives changed. People have given up seeing family and friends. They have given up life in the public space, given up going to movies, restaurants, cultural events, and travel. Canadians have had to work from home. They have had to practice physical distancing, to wear masks, and more. But while we all have been affected in some way, the most vulnerable among us have suffered the most, both from the health crisis and the economic crisis. Young people have lost opportunities that they have worked so hard for. Those in the service sector, especially retail and hospitality, many in low-wage jobs, including many women, have lost their jobs. Seniors in long-term care have suffered disproportionate loss of life. And where data are available, we have learned that racial minorities have experienced higher levels of virus infection. So too have those in low-income households and those living in crowded spaces. And so too have essential workers, many in low-wage situations. COVID-19 has not been the great equalizer. Rather, it has made existing inequalities worse. Now we are trying to build back and build back better, as the government so often says, even as we battle the second wave of infections. The speech from the throne last week outlined a great many measures. The government promised to invest in healthcare, create 1 million jobs, direct funding toward housing and infrastructure, and inject capital into many other areas of the economy. Two commitments there caught my attention. Specifically, the promises related to long-term care and the promises related to childcare. On long-term care, the Governor-General stated that, and I quote, "One of the greatest tragedies of this pandemic is the lives lost in long-term care homes. Elders deserve to be safe, respected, and live in dignity. In our study into the government's response to the pandemic at the Senate Standing Committee on Social Affairs, Science and Technology, we heard calls for improved training, better salaries, more staff, and better monitoring and oversight in senior care facilities across Canada. We also heard that from experts that the federal government should create change by making funding to the provinces contingent upon improved regulations, standards, and information sharing. I was pleased to hear in the speech that the federal government intends to work with the provinces and territories to set new national standards for long-term care and also to do more to ensure that Canada's elderly stay in their homes longer. With regard to childcare, I was also pleased to hear the Governor-General announce that, and I quote, "The government will make a significant, long-term, sustained investment to create a Canada-wide early learning and child care system." Colleagues, it has been 50 years, yes, 50 years, since the Royal Commission on the Status of Women made it clear that access to affordable childcare is one of the biggest hurdles standing in the way of women's economic equality. And when the numbers have come out in recent months, the reality of that inequality was laid out very plainly. Women represented 70% of the job losses in Canada among workers aged 25 to 54 this past March. And as recently as June, mothers of school-aged children were less likely to be employed when compared to fathers of school-aged children. While a national child care strategy is not the silver bullet, it is a terrific start. And as are programs like the Canada Recovery Caregiving Benefit, which acknowledge that women disproportionately play the role of family caregivers. But meaningful change will require federal leadership. It is incumbent on the federal government to ensure that any agreements they reach with the provinces in return for federal dollars set standards for these programs, including better information collection and sharing across jurisdictions, monitoring, and even sanctions. The recent arrangements made with the provinces in the Safe Restart Agreement in return for $19 billion federal dollars, for me, do not inspire confidence. As mentioned earlier in my question to Senator Gold, I have looked at these agreements. For example, when it comes to long-term care, I see some mention of increased staffing levels in some of the agreements, but I do not see mention of the standards that are so needed and that have been called for by experts to ensure health and safety in seniors and long-term care facilities. So that is one tremendous concern that I have when I look at those agreements. And here's another concern. When it comes to data management in long-term care and across the health domains that are of interest to the federal government and in the domains to which they have directed federal dollars, I see some mentions of data sharing across the provinces, but no mention of sharing with the federal government, with the exception of the case of one province, British Columbia. The federal government is funding data sharing, but seems not to be getting any data for its important purposes. So that is what I see when I look at these agreements. And furthermore, I do not see in these agreements the ability to monitor results, and I see no sanctions or penalties if a province fails to act in respect of these agreements. Now, maybe there is fine print. I would be very happy to be proven wrong, because believe me, I want to see change. So, without these provisions, how can we be confident that we will indeed improve these programs, that we will help those people in need, and that we will build back better. Senators, I support the legislation before us today, but let us not lose sight of how to achieve the significant and long-term change that we seek. Thank you very much.